As the number of coronavirus cases grows around the world, we spoke with a patient who recovered after becoming sick with COVID-19. Hello, I'm Anand Naidoo, and this is The Heat. Amid the global pandemic, the view remains the same. Deserted streets. People all around the globe are staying at home to prevent the spread of COVID-19. In some cases, it's mandatory. Countries like Argentina are under lockdown. Here in the United States, several states ordered all non-essential workers to stay at home. For more on the response to the pandemic, we turn now to CGTN's Roy Ruttenberg in our newsroom. And Roy, US President Trump spoke today, and he's been doing that all week, actually, and he said that for now, there are no plans for a nationwide lockdown.
That's right, Donald Trump facing a lot of those questions. Donald Trump noting that the hotspots, the core areas of community spread, have actually occurred in specific areas, and that's why we're seeing both his resistance and also why we're seeing places like introduce so-called safer at home orders. The state of Illinois, where Chicago is, the state's 13 million residents, just in the last few hours, ordered to stay in. And also the state of Connecticut just recently added to that list. Those states joining places like California, these massive states, New York as well, which had put in some of the strictest measures we saw. Los Angeles County in the last hour announcing dozens of new confirmed infections. This just one day after putting in place its new stay-at-home measures. Health officials there in Los Angeles County saying 10% of people testing have been confirmed as positive. We should note, however, not everyone is being tested. Of course, that's something that's happening differently in different countries. Only those with considerable symptoms are getting tested. Also, in the last few hours, New York's governor ordering all workers in non-essential business to stay home, and also banning gatherings statewide. More than 200 deaths now reported in the U.S., more than 17,000 confirmed infections nationwide. And also, Anand, in the last hour, we're getting confirmation from the vice president's office that someone in that office has been infected. They're saying the vice president has not had significant contact with that person.
Roy, President Trump earlier today also talked about something called the Defense Production Act. That's a wartime measure. What does that mean?
Well, essentially, Trump is pulling the trigger on emergency war powers and putting into effect an executive order he signed just days ago, a law that he said he'd only use in, quote, a worst-case scenario. The Defense Production Act will, in theory, accelerate domestic production of medical supplies that are urgently needed by U.S. hospitals. The move allows the administration to force American manufacturers to make medical items that are in short supply domestically, and it requires those producers to sell those items to the U.S. federal government. We should note the president also announcing on Friday other measures, economic ones, a cash payout to American families, a 3-month extension on U.S. federal tax filings, and a deferment for 2 months on federal student loan payments. All moves, he hopes, will provide some relief to Americans during this difficult time for the nation and, of course, for the world. Anand?
Thanks, Roy. That's CGTN's Roy Ruttenberg reporting there. Well, earlier today, I spoke with Clare Gerada, a British doctor who got infected and has recovered from the coronavirus, and I started by asking her to tell us about that experience.
Well, it was probably the worst illness that I've ever had. Saying that, I'm not often ill, but it was very high temperature, aching limbs, really severe headache, a dry cough, and I was really polax. I was debilitated for 3 days. I just stayed in bed. So it was pretty grim, really.
And when did you first get these symptoms? What did you feel when you thought you had the virus?
Well, the very first thing was a dry cough, but as I'd just come back from New York on a long-haul flight, I thought it was just, when you do a long-haul flight, you get dry air in the cabin, so I thought it was that. But when I got a very high temperature soon after that, I realised it wasn't jet lag, it was corona. I thought it was corona right from the start because New York had just declared a state of emergency. And then the symptoms were more or less that, very high temperature, aching limbs, dry mouth, feeling unbelievably tired, not wanting to eat for 3 days, and then the symptoms reverse. So the first thing to go was the temperature, and the last thing to go was the cough.
So you had all those classic symptoms. It's almost textbook stuff that we're being told every day by the experts. How long did the symptoms last?
Probably all told, 2.5 days. About that. I mean, the fatigue and the muscle pain went on for about another 4 days after that. But and a very odd taste in my mouth, which I've still got, a sort of metallic taste, which some people again are describing. But the symptoms itself that we're hearing about, probably about 2.5, 3 days.
So
not long.
Right, and I presume once you felt these symptoms, you got yourself tested. What was that process like?
Well, at the time they weren't testing people from America, people who'd come back from America, because it wasn't one of the risk areas. But I managed to persuade them, because of the state of emergency, not just in New York, but also in California. So clearly it was around America. It was 3 throat swabs. I mean, it's a very simple test. It took a few days to get back, but very, very simple test. They put a throat swab down the bottom of your throat, and that's the end of it. And I then left. I got tested in a hospital in a pod. We had testing pods. I think that's slightly changed now. I then went home to bed and didn't leave bed for 3 days.
And when you had these symptoms and when you were tested, did you immediately go into isolation, cut yourself off from the rest of the world?
Yes, but to be fair, I didn't want to do anything else. I cut myself off from my husband, who is in the same house, and so he slept downstairs, I slept upstairs. We used separate bathrooms, separate towels and everything. Now, he hasn't got it. He's a bit disappointed he hasn't got it, because I think he would have quite liked to get it over and done with. But so he must have practiced very good social isolation, social distancing, because if the person closest to me hasn't got it, then clearly we did very well in keeping apart.
So you stayed away from your husband, you stayed away from others. What else did you do to mitigate the symptoms?
I took a few paracetamol, but in all honesty, they don't touch the temperature. I forced myself to take them for the pain. The pain is really aching, horrible aching pain. So I took them, but if I didn't take anything, it wouldn't have made any difference. I couldn't be bothered. I was so full of malaise. I tried to drink, and I had natural yogurt and some honey, and I had a fan which I put on intermittently. But that was really about it. Time heals this. I mean, the time heals most viruses. It's nothing magic about COVID-19. Virus infections don't respond to antibiotics. This one doesn't respond to antiviral agents. So you just have to use time, and hopefully your body, which my body did, fought the response, put up a defense, created antibodies, and protected me.
At what stage, Claire, did you realize that you'd got over the worst of it?
Probably four days in, when the temperature disappeared, and though I felt very fatigued, I knew that there was absolutely no way I was going to die. I didn't even think any time I was going to die. I did get a bit breathless, but at no time did I think my life was at risk. So clearly people who are becoming very, very unwell, they have underlying health conditions mainly, and I don't. For most people, such as myself and others, it's just a grim flu-like illness, really grim, which you just have to get through. But I never thought it was fatal, ever. And as soon as the temperature went, I knew then it was just a matter of time till my body sort of sorted out whatever the chemical insults had been over the previous 3 days.
And are you confident that you are now safe? Because we've also heard of these cases where the virus mutates, comes back in a second wave.
Yes, I think we've got to be very careful what we're saying. There's some cases that people are being tested too early, and so they're still positive, and then people think they've been reinfected. And actually, looking at the evidence from China, sharing so much useful information, it doesn't appear that these people are getting reinfected. It's the same illness. Then we're hearing about the mutation. Now, we're going to soon find out, because clearly as China comes out of quarantine, we'll now see what the virus is doing, how many it's infected, what the second wave of people who haven't been infected are about. As far as I'm concerned, I'm now immune from this virus, from COVID-19, so I'll be returning to work on Monday morning.
And looking at the bigger picture, Claire, the Chief Medical Officer for England, Chris Whitty, he made a gloomy comment about coronavirus. Let's listen to what he had to say.
It is our judgment, and it is my judgment certainly, if you look around the world, the idea that we're going to put this virus back to going away completely, whilst not theoretically impossible, seems so improbable that basing scientific evidence on the theory that that is something we are trying to do seems to me a mistake.
So the chief medical officer there for England is saying something that we've heard here in the United States as well, that this is going to get worse before it gets better. Do you think that is the case?
Certainly, I think it's going to get worse in some places. It's going to get worse in the UK because we've only just started. It's certainly going to get worse in the States. I think what he's saying there, though, if I'm understanding him correctly, is that the idea that this virus is going to disappear from humans in the next 12 weeks, the next 18 months is nigh on impossible. It will still be around. It will still hit people. But I think what we're hoping is that we get through this initial phase of containment, flatten the acceleration of people that are being infected, and then deal with the people that are going to get it, because it's not going to disappear further down track, without this enormous volume of people all getting it at the same time.
Would you say your case was typical of the people who have contracted the virus? I mean, do people have easy access to testing kits, to getting some kind of help?
Well, we don't have easy access to testing kits at the moment. I'm hoping that's going to come in. I think mine was probably on the moderate end of severity. I've heard of people since who've had a 24, 36-hour illness, feeling lousy, taking to bed, drenching sweat, aching limbs, dry cough, and then bouncing back up again and carrying on their lives. So, and then, of course, you're hearing of people who have had an asymptomatic illness, no symptoms at all. So I think I was probably on the moderate end, not the severe end. I did actually have a way of measuring my oxygen saturation, which dropped a little bit, but not considerably. So on objective measures, mine was at the moderate end. But I've heard people having very mild illnesses.
And I'm sure you've thought about this, and that is when and how you probably got the virus, whether it was in New York, whether it was on the plane, whether it was when you got back.
No, it was undoubtedly in New York. That the time span of 5-day incubation, it's not conceivable it wasn't anywhere but New York. I didn't arrive with the virus at New York. I was there for 6 days, and it came on me 36 hours after I arrived back home. So, and it's certainly not from the plane because the incubation is too soon. So, and I've since found out large numbers of people at the conference that I've was at have also got the virus. Now, there's no testing, or very little testing in the States, but those who have been tested are positive, and others have been told that symptomatically they've got it. So, and it was a large international hotel, 3,000 or so guests, including large contingents from Italy and various other places. So without a doubt, that's where it was.
Claire, you've recovered and you're well. Thanks so much for being with us.
Pleasure. And take care and look after yourself.
Thank you. Clare Gerada talking to us earlier. Well, let's continue our conversation right now on the coronavirus pandemic. Let's bring in our panel. Joining us via Skype here in Washington, D.C., Kate Tulenko is the CEO of Corvus Health. Also from Washington, Joseph Williams is the senior news editor for U.S. News and World Report, and current affairs commentator Einar Tangen joins us from Beijing. Welcome to all of you. Joseph Williams, let me start with you. If we look at the situation in the United States right now, more than 230 deaths in the U.S., thousands infected across the country. The president has announced international border closures, that's on the Canadian border and the Mexican border, and several states have ordered non-essential workers to stay home. Looking at the events of the past 24 hours, what is your assessment?
Well, that the phrase, it's going to get worse before it gets better, is very much in play right now. I mean, certainly beyond what you just described, we have governors in California, Illinois, and presumably other states to come that are putting their entire states on lockdown. This means no essential travel in or out of the state. Everyone must stay in their homes. Right now, that's a step or 3 short of martial law, but a lot of people are sensing that that's how it's going to go. So we certainly are in the midst of I would suggest that we're at the beginning of the end of the beginning. We're very much ramping up here. Things are going to get worse before it gets better. Right now, I personally know of a couple of friends of mine who have had people who they know who have either contracted the illness or in some cases have taken very severely ill. And it's going to continue in that direction. We're all going to know someone who is contracting this illness by the time it reaches its height, I'm pretty sure.
Just to clarify something, Joseph, are you seeing the day very soon when we could see the military deployed on the streets of the United States?
Well, they're already in some places. They're in Baltimore right now. I don't think it will be full-on martial law so much as helping encourage the population to stay indoors and not do anything untoward. So it won't be the worst case situation from what I understand. This is just preliminary to try to augment law enforcement, to try to help encourage people to stay inside, and to set up some medical facilities to help augment what's already there.
Kate, looking at the medical announcements that were made, what do you make of the measures taken so far?
Okay, so there are two basic ways that we address the current outbreak. One is prevention, and so that's the social distancing, the closing of schools, the closing of businesses and borders. And then the second is treatment, so that people not only live, but that they live without disability. Because there's a concern now with some people potentially having permanent reduced lung function, so that's a concern. And also, as we develop more treatments for COVID, if people can stop shedding the virus faster, that will mean that they're less likely to infect other people. So treatment actually has a prevention part as well. And a big issue still is the issue of the testing kits. I'm not aware of any hospital, any state that has enough testing kits. And in fact, Nevada recently announced that they've been told by the CDC that their requests are on back order with no date given of when they'll receive new kits. And so I'm glad that the president has, released the Wartime Act of being able to mandate to companies to produce some of these needed supplies, gowns, gloves, testing kits, because that's going to be a huge part of the response.
Kate, when you talk about treatment that will help people shed this virus, what treatments are we talking about?
Sure. So one is remdesivir, which is a new antiviral that's been shown in China to make a difference. And it's currently just experimental and is available via the FDA compassionate use laws. And the big issue here is, can Gilead scale up the production fast enough to make that available? And then the other potential treatments are the drugs such as chloroquine, that there has been one very small study in France which shows that it reduced the viral load, but more data and more studies are needed. But then there are also other companies working on potential treatments, as well as a vaccine, of course, because if we are able to vaccinate especially high-risk individuals such as health workers, people with heart disease, chronic lung disease, that will help quell the outbreak as well.
All right, let's go to Beijing, to Einar Tangen. Einar, there is some good news coming out of, well, I should say relatively good news coming out of China from Hubei province, Wuhan city in particular. There have been no domestic infections in the past 2 days. In fact, this is what the Director General of the World Health Organization had to say. Let's listen.
Yesterday, Wuhan reported no new cases for the first time since the outbreak started. Wuhan provides hope for the rest of the world that even the most severe situation can be turned around. Of course, we must exercise caution. The situation can reverse, but the experience of cities and countries that have pushed back this virus give hope and courage to the rest of the world.
So, Einar, as the Director General of the WHO said there, does this give us hope? Has China turned the corner?
Well, it would appear that way. I mean, when in these kind of viral outbreaks, you want to know where your peak is and where things start to go down. But, in talking about this, you have to talk about leadership and strategy. There's two very different ones that have emerged. There's China's, which is containment, aggressive measures to make sure it doesn't go any further. That seems to have worked very well. But in the U.S. and Britain, it seems to be, we'll live with it. This is something like a storm. We'll let people go through. We can thin the herd a little bit. So it's a very, very different idea. So based on which strategy you take, you're going to do different things. I mean, I think in both Britain and the U.S., the main issue is about the economics and how to recover from that. I think the health has taken second place despite all these kind of last minute, let's do something now. There wasn't much preparation put in, the testing kits, social distance, Just even the messaging was mixed. So it's really about what the leadership thinks is the best thing to do in the country and how they implement it.
Kate, what are your thoughts on the news that's coming out of China?
I think it's very encouraging. And I right now have a more positive view that I think we can get rid of this. I don't think it's guaranteed that this will become a seasonal, annual outbreak like the influenza. I think that with fast action now, we can break it the way that Wuhan has.
Joseph, talking about all the measures that President Trump has announced, he's also talking about, and he's being urged, of course, to use all the resources of the federal government to fight this virus, but he's also talking about invoking what we talked about earlier on, something called the Defense Production Act. What will that do? How big a change would this be?
That would be a fairly radical change. It's sort of the Hail Mary of trying to ramp up production on certain items like ventilators and hospital beds and masks. It would basically direct the president, or allow the president, to direct manufacturers and some people who are outside of that particular system to scale up and do only this one thing that the country needs. It's used in terms of wartime, in terms of like producing tanks or weapons or that sort of thing. I mean, but the problem here, though, is it is too little, and it could very well be too late for very many people. And leadership does matter in this situation. If we had gotten ahead of the curve, we wouldn't have to be in this situation necessarily. Even when we are talking about production, ramping up production, and in situations in China where no new cases have been reported, you still have to look at no new cases, or basically the flatline curve, for longer than a day. It's got to be more days. It's got to be almost a week, perhaps several, in which you have no new cases. And that's really the benchmark from what I understand. And in ramping up production here, it's undeniable that some people are going to suffer and die before the scale has reached up. It's already happening, and the virus has even reached the vice president's office. Late this afternoon, there was an announcement saying that someone in Vice President Pence's office has tested positive. They have suggested it is not the vice president, but we don't know. And so that pretty much demonstrates that this virus is not discriminating, and urgent action was needed 2 weeks ago. So the best we can do is hope to contain the amount of damage that we're already going to have.
Right, we did see those draconian measures that were taken in China. An entire region was put under lockdown when the virus outbreak happened. One point, Joseph, and that is under these powers, wartime powers, as you say, can the president basically get any manufacturing facility in the country to start manufacturing things that we need to counter the virus right now?
That part of it is unclear. President Trump has said he's reluctant to do that. And it would probably not be necessarily a great idea to have somebody who's manufacturing something other than medical equipment suddenly try to pivot and do that. And along with that, you've got the risk of infecting that particular workforce, because they would be working in close contact with each other. So it's a very complex situation that's going to be difficult to resolve over the short term.
Kate, during the Friday news briefing, the daily news briefing that's being held by the White House, Dr. Deborah Birx, who is on the president's team, she's the coordinator of the coronavirus outbreak, she said that she's concerned that the mortality rate was twice as high among males than among women. That's the figures we're getting out of Italy mainly. What can we read into that?
So there's some thought that it might be linked to smoking. For example, in China, there's a huge difference between male smoking and female smoking, and the same in Italy, that men tend to smoke more than women. Part of it might be also the prevalence of comorbid conditions, of other health conditions might be a factor. Also, it's been found in other medical conditions that women tend to have a physical resiliency. Or another possible idea is that there's a receptor in every cell called an ACE2 receptor that the virus binds to. And it might be that men have more of these ACE2 receptors, but it's really not known. It's something that needs to be investigated. And I think one opportunity that China has now that they're recovering from the outbreak is they can do a lot of this research, because they have a lot of people who have been infected, and they can look at their data and really come to a lot of conclusions that will help all the other countries struggling with this right now.
One other point, Kate, a few days ago, the president made this assumption that this could go through until July or August, and that would be the worst of it, and then it'll probably get better after that. What do you make of that timeline?
So I think there are three possible scenarios. One is the Wuhan scenario, where it's done in 2 or 3 months. And hopefully doesn't come back. And so that's what the president mentioned. Another scenario is the scenario that the UK has mentioned, which is it will be around for maybe a year or more. And then the third scenario is a scenario where it never goes away and becomes an annual event, such as the flu.
Right. Einar, regrettably, this is a worldwide challenge right now, but regrettably here in the United States, it's also been politicized. At the Friday news conference, the United States Secretary of State Mike Pompeo criticized China. Let's listen to what he had to say.
We need to make sure that even today, the data sets that are available to every country, including data sets that are available to the Chinese Communist Party, are made available to the whole world. And so when you see a delay in information flowing from the Chinese Communist Party to the technical people who we wanted to get into China immediately to assist in this, every moment of delay connected to being able to identify this the risk vectors creates risk to the people all around the world. And so this is why it's not about blaming someone for this. This is about moving forward to make sure that we continue to have the information we need to do our jobs.
So, Einar, what do you make of these criticisms and the kind of language that U.S. leaders have been using?
Well, clearly, they flubbed the response to this. I don't think anybody would disagree with that. And now they're looking for a scapegoat. They're trying to, call this the China virus, Kung flu, these kinds of things. And that statement there, it's constantly pointing at China as somehow the reason that the U.S. has not prepared and taken effective action.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat. And we leave you with pictures from Turkey, where people gather at their windows to applaud healthcare workers in an act of gratitude for their work. I'm Anand Naidoo in Washington, D.C. Thanks for being with us.
CGTN, covering coronavirus. From Asia, Africa, Europe, and America. The dangers, the uncertainty, a global effort to stop the spread and save lives. For the latest updates on coronavirus, stay with CGTN. See the difference.
Hello everybody, I'm Anand Naidoo. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week we take a deep dive on world headlines, talking to experts, journalists and others. It's a fresh, focused and intimate look at the issues that matter most. Whether you're at home or on the go, you can find The Heat podcast just about anywhere podcasts are found. Have a listen today and subscribe. Thanks.